So this is Jody Tropeano, the Content Director for Health, and I'm lucky to be here with Ann Mond Johnson, the CEO of the ATA, and Dr. Joseph Kvedar, the President-elect of the ATA. And we're going to chat a little bit about the current COVID-19 crisis in the US. So Ann, to kick it off, can you please give us a little bit of a background on the ATA organization?
Sure. The ATA is over 25 years old, and it was started by the pioneers, the researchers, the academicians and clinicians who really began the field of telehealth, telemedicine. And it rapidly evolved. And when I joined the organization 2 years ago, my background was not in associations. My background was with startup companies. I had done a series of startups in healthcare. And so my orientation was a little bit different, and what we realized was that while telemedicine had been around for a long time, the adoption engagement was just not very aggressive. And so we embraced a new vision for the organization, which was really to ensure that people get care where and when they need it. When they do, they know it's safe, effective, and appropriate, while ensuring that clinicians can do more good for more people. And consequently, we've said that our focus on adopting telehealth and accelerating the adoption and engagement in telehealth has really been very much at organizational level. And so luckily, we were able to convince Joe to come on as president-elect. He was elected, and very excited to be collaborating with him, and happy to be talking with you, and thank you for the opportunity.
Yeah, thanks for being here. And Joe, following on that, you're a telehealth pioneer in the industry. So why do you think it's taken this long and a global health crisis to get telehealth to this point?
Well, I think the shortest answer is that doctors were busy. They were busy with their face-to-face practice. They all had a full waiting room and a 6-month wait. Lately, that was compounded by this issue of fatigue over electronic records. So think about it, if you were in the office all day, straight out, had to go home, put your kids to bed, do your charting, and then think about telehealth, right? And the system was working for them. So it was hard to get people to change this. It's really interesting that we have this crisis on our hands now, because all of a sudden the world has changed and they're saying, no, we want to see people in their house. We want doctors not to come into the facility, and all of a sudden we're making it work. So, but that's why I think before it wasn't flying.
And why do you think telehealth has been so uniquely positioned to combat the coronavirus?
Well, because we all want to stay where we are. So the idea of meeting someone is a risk. It's a risk for me as a doctor, it's a risk for you as a patient. And if we can do, and somewhat tailor-made for telehealth is the notion that both screening for and following patients with this condition is largely about asking questions, which we can do very nicely over video, as we're doing right now.
Yeah. Mm-hmm. And let's switch over to some policy questions.
Sure.
The CARES Act was just signed into law. Can you give us a little bit of an overview on that and why it's so important for the industry?
Absolutely. And I want to really commend our members, who include delivery systems, academic medical centers, pediatric facilities, payers, as well as solution providers across the board, who worked with us to ensure that this legislation came to pass. And what's exciting about it is that it's really opening up the door in a number of significant ways at the federal level to ensure that telehealth is really made much more mainstream and much more put into the system, if you will, particularly with things like the federally qualified health centers, which now get reimbursed with telehealth, or the rural health centers. And generally speaking, I would say that the importance of this is that the regulations that we've seen both at the federal and state level are being relaxed to the point that they're finally catching up with technology and what technology can do for patients and clinicians.
Okay. And following on that, there's also been some restrictions that have been eased for providers seeing patients outside of the state where they're licensed. So what is the ATA recommending there, and how have the states been responding?
Well, again, in collaboration with our members, we've been very vocal about this. We think it's a real opportunity because one of the challenges has been that telehealth can address access and can address immediate access to clinicians that are needed regardless of where people live. So we have this issue in the United States that our geography defines our healthcare destiny, and that doesn't need to be that way. And so what happens with these restrictions being waived or loosened, if you will, is that it allows clinicians to practice medicine across state lines if they are qualified, if they're licensed in another state. And so much in the same way that you drive your car from New York to DC, it's of the same ilk. I would say that this is not the case in all states, and so we have been very clear about guidance that we're offering the governors about what they should be doing, as well as ensuring that that other practitioners, think of nurses and physician assistants and advanced practitioners are able to really provide medicine, which they can without onerous requirements for supervision.
Excellent. And Joe, so outside of patients getting treated via telehealth for coronavirus symptoms or treatment, what other ways is telehealth being used to just help people cope during this crisis?
Great question. So a number of ways. It turns out before we had the pandemic, the most rapidly adopted form was tele-mental health, behavioral health, because again, as we sort of said earlier, the physical exam is talking to the patient, and this is a perfectly good medium for that. So people are going stir crazy, mental illness is getting a little bit ramped up, people who have it, and it's a perfect medium to be able to get a mental health practitioner. And then the other I would say is remote monitoring for chronic illness. Beautiful set of technologies that was kind of sitting there waiting to be ramped up. And for people with conditions like heart failure, diabetes, high blood pressure, we can now care for them in their home with tools that are relatively ubiquitous and get them cared for without having them have to come in the office. So those are two examples.
Mm-hmm. I would just add to that I've been really encouraged by the adoption of telehealth by practitioners who just want to maintain their patient practice independent of COVID. They have asymptomatic patients that need continued guidance or interaction. And I think it's been great how they've really adopted to this very, very quickly.
Mm-hmm. And to the both of you, what challenges are your members seeing with the increased adoption and the rate that's gone, through the roof from before the crisis of telehealth usage?
Well, I think one of the things that we've seen is the surge in demand. And as we talk about flattening the curve and the importance of keeping people away from brick and mortar facilities because you want to mitigate the risk of exposure, what we've seen that's been really fantastic is the adoption of chat first or chat forward tools that are, in our word, called asynchronous. And these are interactive assessments that can be done either online or through someone's phone to help them assess and understand better what COVID-19 is, what is the coronavirus, what are the symptoms, and then help them assess their symptoms and see whether or not it needs further care or further guidance. And these asynchronous tools have been phenomenal in terms of helping delivery systems scale demand. Without them, I think we would still see many, many more people rushing towards the emergency room or their physician's office, and we wouldn't have seen what we hope is the flattening of the curve.
I would just add that I think the big challenge is probably not with ATA members, to be candid. I mean, as a group, they were already on board enough to join. So there's a little bit of raised consciousness there. But if you look across the nation, we're bringing on tens of thousands, of hundreds of thousands of doctors onto a new platform and nurses. Some of them have never done it before. Some of them are reluctant. At Partners, where I work, we're on a pace to bring 11,000 doctors onto a platform that we were going to do over several months. We're doing it in days to weeks. So you can imagine, unfortunately, there will be some hiccups. And the technology, I'm so delighted that Zoom is working well for us today, but there have been times we've probably all been on Zoom calls that it's hiccuped. So the servers are getting overloaded. And what I'm just saying to anyone who will listen to me is that we have to deliver high quality care. We have to care for our patients, because the last thing we want coming out of the other end of this is for them to say, you know, I tried it and it wasn't so hot. I didn't get my doctor on the line. It wasn't a very good experience. That will kill it. So
Mm-hmm.
we have such an opportunity to convince the world that you don't have to come to the office just to get your health care, like every other service you consume.
Mm-hmm.
But we have to make sure we deliver high quality and care for our patients well.
And on top of that, so most health systems and providers are using telehealth right now, but some are not, but looking to adopt it in the short term or to help patients dealing with the COVID crisis. So what tips would you give those new adopters or people just looking to expand their current services?
Joe, you want to go first?
Sure, I would say, kind of following on what I just said, that not every single thing is telehealth friendly. So there are certain things that you do need to come into the office for. We're not suggesting that the office fit is going to go away forever. I mean, procedures are an obvious thing that we still haven't quite figured out how to do remotely yet. So I think being thoughtful, if you're a new organization, a new group, it's not one size fits all. It's not one uh, platform fits every single illness or every single follow-up. Being thoughtful about what works. There's lots and lots of guidance on our website, lots and lots of lessons learned from the more sophisticated members of the organization. And that's one of the beauties of ATA, is that it's a very kind of open sharing environment for people who want to learn more. So one piece of advice is join up and get access to all of that.
And there have been phenomenal webinars that we've been doing on a pretty regular cadence that demonstrate these best practices and have a lot of Q&A in them as well. So, and they're recorded for people to access after the fact.
Great. We'll make sure we'll share those on our health
Great.
page. And just a final question for the two of you. Where do we go from here past this crisis? What does telehealth look like? What at the ATA will you be focusing on? Is this a new world that we're entering?
Well, from my perspective, and I think Joe shares this, is that, as he mentioned, we have a real responsibility to ensure that even adoption that is going quickly is done in a high quality fashion. And so we're committed to that. I know our members are committed to that as well. And with that, then, it is really an opportunity for us to step back and say, what regulations, while they were relaxed now, which do not bear being rolled back in the future? So to be very thoughtful about that and to say what was put in place, not necessarily for the good of the patient or the clinician, that we can really honestly examine now did not provide value. So those are some of the things. I think the other issues that we're going to deal with as a society that telehealth can play a big role in is the whole notion of what happens with so many uninsured and Medicaid members in the future, because we know because of the economy that's going to happen. And we have an opportunity there, a demonstrated value proposition.
Well, it was almost 27, 28 years ago that I was doing a little study on digital imaging and dermatology, and I had this epiphany that maybe the doctor and the patient don't always have to be in the same room at the same time to get something done. So now that the world has realized that that's possible, it's going forward from there. That's such an important moment in history to say, because let's face it, the vast majority of both doctors and patients up until now thought that the reflex was, if you had something you needed to get taken care of, you went to visit in the office, and that was part of what was holding us back. So the world has woken up to the fact that we can deliver this service like you deliver Uber or Lyft or so many other services you consume. And again, as long as we do a high quality job, and as long as we're thoughtful about what we try to do, as long as we give our patients, and I keep coming back to this, but they must feel cared for. All of those things will have happier people. The virtual urgent care service at Partners Healthcare before all of this had a net promoter score of over 70. When people called in, they got a doctor within 5 or 6 minutes, and their answer to their question successfully about 80% of the time. What's not to like about that?
Right.
True.
Well, thank you both for joining us. Hope you're well and your families are well, and we'll get through this.
Thank
Right.
you. We
Stay
certainly
healthy.
will. And we'll come out the other end even better.
Yes.
Indeed.
Thank you.
Thank you both.
Bye-bye.
Thanks for watching this interview. We're doing our best to keep our health community up to date and informed as the pandemic progresses. So please check back for more interviews and blog pieces with leading health experts, as well as check out our Health COVID resource page for more information. Thanks again.